This video is talking about the 4 stages of Hashimoto's. Questions people ask are, how serious is my Hashimoto's? Is there a way I can just use natural means? Do I have to use pharmaceuticals? Or can I use both? Listen on. With Dr. Kamat, we're talking about diagnosis of hypothyroidism as well as Hashimoto's.
Patients usually come with symptoms of like maybe just chronic fatigue. They may have brain fog, they may have hair loss, they have brittle nails, or they have very dry skin. Or they may have other comorbid conditions like diabetes or celiac disease or even any other autoimmune issues. Then
Yep.
there is a suspicion of the thyroid being affected. So in these cases, we look into TG antibodies and the TPO antibodies, TSH, free T3, free T4. This would be the basic thyroid panel.
Okay.
What we have seen in research is that one can have a normal TSH, but yet they can have all the symptoms of hypothyroidism if the antibody levels are high.
Do you mean normal TSH, lower
Free TP,
FT4?
normal free T4, but the antibodies are high,
Yep.
you can have most of the hypothyroid symptoms.
Understand. Okay, so that is a very important thing to know. You can have raised antibody levels, but normal rest of the thyroid panel.
So the Hashimoto's go into stages. So there's not just immediate, free T3, T4 elevation. First, there is maybe mild elevation of the thyroid antibodies. T3, T4, TSH is within normal. The second stage would be higher normal antibodies. There's again different kinds of stages in antibodies. So maybe higher normal antibodies and TSH, free 3, T4 is again normal. These two stages are usually not detected in a conventional lab work. There, people seem to be, all is well. People say, "Oh, you're good. Don't worry about it." Stage 3, high level of antibodies, and then there is TSH mild elevation. And then the stage 4 would be T3, T4 is also affected. TSH is affected and very high levels of antibodies. Stage 3, 4 are when the patients are detected of an autoimmune thyroid condition. But
Understand.
if it's initially detected in stage 1 and 2, this is where we can prevent that progression going to stage 3, stage 4.
Okay, so if I'm reading you correctly, person comes in with symptoms, FT3, FT4, TSH normal. Your suggestion is let's go and check the antibodies because they may be raised. And if they are raised, then what you can do is going to be really helpful before the person reaches stage 3 and stage 4.
Yes, yes. And there are different ways of managing different stages. Sometimes you might not have to do anything if it's a very low level antibodies, like less than 35 to 50 is considered low levels. And a lot of people are fine, they don't have any issues.
Can we talk a little more about a case study, someone coming in, the typical presentation, what you do, so that the viewer can understand? Let's start with a simple case. This is a case of stage 1, which is multi-elevated antibodies. Listen on.
I had one patient who came to me, TPO 35, free T3, T4, TSH, everything normal. So we did a few other tests to make sure she doesn't have an autoimmune condition elsewhere.
Mhm.
Okay, so that could be just a minimal inflammation going on. So we don't have to actually work on treatment or any of this stuff in these cases. And they can remain stable if everything is clear. And then we probably monitor this 6 to 1 years time and see everything is fine.
Okay.
Because it takes a very long time for the antibodies to rise or even lower. So it's usually 6 months to 1 year is what
Okay.
will be the duration that we usually do. This person has been monitoring her thyroid antibodies for the last 3 years and it has been around 35, 40. And 5 or 10 points more or less is not really thing that I would be concerned. And she's been fine, it's stable, everything is good.
So that case seems very simple, right? But it's not all like that. That was an easy case. In the next video, Dr. Kamat will be talking about a more complex case, and please watch on.